Today is World AIDS Day, and new figures from the Public Health Agency of Canada show HIV diagnoses appear lower in most regions, but experts warn that this does not mean transmission is down. So the latest national modeling suggests HIV transmission has increased by 15%. And for more on this, I'm joined by Sean Hossain, Science and Medicine Editor with a prominent Canadian HIV news and information resource. Thank you very much for joining us. So we have to start off talking about the new figures. So the HIV diagnoses, they appear lower in most regions, but that does not mean transmission is down. Let's talk about that.
Yeah, I think diagnoses point to people who have tested positive and are in the system, but there are a lot of transmissions that are happening. And in fact, in the last, between 2020 and 2022, HIV transmissions have been gone up by 15%. So transmissions are still happening, infections are still spreading.
We know that there are new goals that have been presented that are actually pretty soon, the next 5 years. What can you tell us about, clearly stating that goal and work towards making that happen?
So these are goals by the WHO, the World Health Organization, and they encourage cities and countries and regions to have 95% of people with HIV have been tested and know their status. So they've got their test results. 95% of those have been offered and are on treatment, and 95% of those are on treatment and have their virus suppressed. And that's really important because when the virus is suppressed, it means they can't pass on the infection and they can lead a normal, healthy life. So it's good for the individual with HIV, and it's also good for society that we reach these goals. The shorthand for those goals is 95, 95, 95.
Okay, so looking at numbers from 2022, just over 65,000 Canadians are living with HIV. There were a little bit over 1,800 new HIV transmissions in the country. That's a 15% increase from 2020. How does the GTA and Ontario fit into those numbers? Did you delineate it that much?
No, I didn't, but I know that across the country, transmissions are going up. I don't have figures right now for the GTA or Ontario, but transmissions are going up everywhere in Ontario and the rest of Canada. And we need to do something about this. And so we encourage more people to get tested. They can go to a clinic, they can see their doctor, they can even get a test from a pharmacist. And if they test negative, talk to their pharmacist or doctor or nurse about ways to stay negative. And if they test positive, talk to their healthcare provider about getting on treatment, because treatment, as I said before, when taken correctly, saves lives and it prevents the transmission of the virus.
Let's talk about treatment, especially with respect to post-pandemic service recovery.
Yeah. So what happened during the pandemic, the COVID-19 pandemic, was that a lot of our testing services were shifted to testing for COVID for good reason, because that was the overwhelming pandemic at the time. And now that the pandemic has largely become less serious, that is COVID, we're back to trying to get people tested for HIV and other sexually transmitted infections. And so it's gone back to full capacity. So we do encourage people to get tested. And if they do get tested, if they do test positive, to ask their healthcare provider about treatment. Now, you mentioned treatment. Treatment today can be as simple as one pill a day, or getting an injectable regimen that's, a couple injections every 2 months. So there's different options for people.
Okay, and as we wrap up, what is one clear message you want to leave people with right now?
I would encourage people who haven't been tested in the past year to consider getting tested, and they can get tested at their doctor, their nurse, a clinic, or from a pharmacy. And if you test positive, talk to your healthcare provider about getting treatment. If you test negative, talk to your healthcare provider about ways to stay negative.
Okay, Sean Hossain, Science and Medicine Editor with the prominent Canadian HIV news and information resource. Thanks a lot.